So I think the Masters module that we've developed is really appropriate for anybody who's working within a hospital environment and has some element of responsibility for being able to get a patient out of the hospital and back to as close to their normal life as possible. The skills that they learn within the actual module itself are very transferable to any hospital environment, whether that be an intensive care environment, whether that be an acute medical ward environment, or even whether that be when they're being treated at home and they've been discharged.
When I was offered the opportunity to come onto this course, I wish I'd have had it years ago, because it just plays right into what I'm trying to develop for our patients now. So my role is to offer psychological support to the patients after their time on critical care. But when the NICE guideline 83 came out, rehabilitation after critical illness, we realised that it wasn't just about the psychological side. There was a much bigger picture that needed dealing with, and my specialist area was the psychological effects of critical illness. So this course then gave me the opportunity to learn more about speech and language, physiotherapy, OT, people I wasn't necessarily working every day with, because we quickly realised that there was, for holistic care, it needed to be all these people involved and not just psychological support.
It's delivered by clinicians, so these are the people that are still working with the patients on a day-to-day basis, are coming in to be able to provide the teaching, and are therefore able to discuss with the students reflections and case studies that are relevant in terms of time and condition and problems.
It just made me think about the wider team as well, because I mean, as a physio you work quite closely with OTs, speech and language therapists, and sometimes psychology whenever we're done in CRU, but it's thinking about that wider team. So how can we make it easier for nursing staff? How can nursing staff work together, being able to identify problems earlier on, whether it's looking at TVN where we need to get TVN involved, and how that can affect our rehab and getting the patient out and in bed, but also thinking longer term what that patient's going to need, you know, whether they're going to need community input as well for that ongoing rehab, and even looking as broad as like vocational rehab as well. So when they're out in the community, when they've done their inpatient rehab, how do we then get them back to doing what the things that they enjoy in the community?
The teaching is designed to be transferable to their day-to-day care, and then the assignment that they're requested to do is a portfolio-based assignment, which hopefully asks them to reflect on both what they've learnt and what they do in a day-to-day when they're treating patients, and to pull those two areas together and take from that a huge amount of learning in a complex rehab arena.
The teaching is only a half-day session once a week. It's about 13 weeks. And it's here at the Sid Watkins where a lot of rehabilitation goes on. The tutors who come are all from the specialist areas, and the people who are doing the job, the people who are working on the shop floor, which makes a massive difference. And it's very interactive. I haven't finished the course yet, but everyone who have come across each session, they want us to be involved. They want to talk about our experience, what we think works and what doesn't work. So it doesn't really feel like a formal teaching session, it's quite relaxed.
Mostly the learning objectives was looking at having a broader understanding of the MDT and how we can work together to improve improve MDT work and to improve rehab from day one right up and right through the pathway as well for when the patient's discharged and even after the patient's discharged as well.
The modules, it's highlighted a few areas that I need to develop in, definitely, so that's been really good, and it's sort of reinforced some of the areas that I've worked in the past, and it's definitely encouraged me to bring, you know, that knowledge forward as well.
The main thing for me, I think, is to teach me to critically analyse the new research, the different roles, how all the roles work together, and hopefully I'll look more at looking at that research, which I haven't done in the past. It's been very much like on the job learning as you go along, but I'm hoping those objectives will open my horizons and look at other things and analyse them a bit more critically.
It just gives people at least a little bit of space to take a step back, to think about their own practice, I think literally and physically getting away from the sort of day-to-day challenges and joys of working with people and on the ward, is that people need that space to be able to think, reflect. Where are our limitations, where are our strengths of knowledge, but how do we need to develop? And I think the course would hopefully allow people to think about that, and particularly again, thinking about that MDT context, thinking about how does my role relate in the context of another discipline or another profession, and how can I help with that, and where are our limitations, and even as a lecturer it helps you reflect in that way as well.
I think it's also quite unique that we use lots of different teaching methods when we're doing it. So there are practical sessions where we bring in lots of equipment, or we do some demonstrations with the students. There are theoretical sessions where it's more just a structured presentation session. They have case history presentations in order to help them relate that back to practice. There's also video recorded support information online for them to be able to go and just back that up in their own time, so that they can just get a holistic view of what complex rehab is.
By meeting other people, like-minded people on the course, I'm learning from them. I've been to visit other hospitals, I meet other nurses doing the same sort of job, but I think mainly learning more about the physio, the OT and the speech and language, learning from them hopefully is going to help me improve what we can offer on the world to our patients.
I think, just working together to get that one goal, which is to evidently either get that person a lot more independent, get them back to where they were previously, and it's not just one person can do that. It's got to be everyone's opinion and everyone's thoughts.
It's everyone's business, and we're all involved in thinking about the emotional aspect. Okay, we might be, as psychologists, more focused on delivering interventions of that, but nurses and OTs are also attending to that stuff all the time, and I think it's knowing how our particular roles can be of value in different ways to the patients, so we're not just working, as I said earlier, in these silos, thinking that that's someone else's role or someone else will attend to that we're all thinking in that sort of holistic way, that we're considerate of both the demands of other people, but that it's all of our responsibility to be thinking holistically around the person.
As much as we have like a bit of an understanding about speech and language therapy, as much as we have a bit of an understanding about psychology, neuropsychiatry, vocational rehab, this gives you the opportunity to understand it in way more depth.
I think, well, especially for me, being, coming from my role, it's definitely opened up my eyes, and I think, staff who've probably specialised in one area, in one field, if they can then understand how other people's minds work and other professions work, then it'll definitely improve the service they can offer.